Sige. Sige, discuss.
Good afternoon, class. Our topic for neuroanatomy today is the brain cerebral hemisphere, which would include the external and the internal structure. So before I go into the proper and to the lecture itself, let me lay down to you in a simple term what is cerebral hemisphere. The cerebral hemisphere can be likened, is considered as the largest part of the brain. And and it can be likened to a soccer ball. It is not exactly round like that of basketball or a volleyball, but more of a soccer ball. Now, this shows the head, in which it would comprise the different lobes of the cerebral hemisphere. Now, the cerebral hemisphere is not a smooth surface but it will be made up of depressions and elevations, and you call this as your sulci for your fissures, or sulcus if it is singular, and gyros for the elevation, and it will be called as gyri if it will be plural. So your sulcus, which will be on the surface of the cerebral hemisphere, is a depression or fissure in the surface of the brain. So it can be likened that if we will relate it to the ground on earth, it will be a valley because it is a depression. And then the gyros will be an elevation. This is a ridge on the cerebral cortex surface, and it is generally surrounded by one or more sulci. So you have here the gyros, and then you have the sulcus. So this will cover the whole surface of the cerebral hemisphere. Now, there are different fissures and sulci in the surface of the cerebral hemisphere. And sometimes it can be likened that these surfaces this surface in the cerebral hemisphere could be that of similar to a fingerprint, because for each individual there is a typical the arrangement of fissures, but there will be 6 typical continuous fissures in which each one of us will have the same shape. So you have here the interhemispheric fissure or the longitudinal cerebral fissure, then the Sylvian fissure, your interhemispheric fissure or your longitudinal cerebral fissure will separate the 2 hemispheres of the cerebrum. Now then you have your Sylvian fissure, which is also known as your lateral sulcus of Sylvius, and this will separate the frontal and the parietal lobes, in which it will separate it from the temporal lobe. Then you have your parieto-occipital fissure, which is found in the medial surface of the cerebrum. These two, it is located in the lateral portion. While you have your collateral sulcus also, which is also a medial fissure, the central sulcus, which is a lateral fissure, which will be a separation of your frontal and your parietal lobe. And you have the calcarine sulcus, which will separate, which will be seen in the medial surface. So we go to the longitudinal fissure. As I have said earlier, it is known as your median longitudinal fissure. This is a deep groove that will separate the two cerebral hemispheres, or the cerebrum. And lying within it is the continuation of the dura mater and is known as your falx cerebri. Then you have the Sylvian fissure, otherwise known as the lateral sulcus of Sylvius. This separates the frontal lobe and parietal lobe from the temporal lobe. And this is seen in both hemisphere of the cerebrum. So you have two Sylvian fissure, one for each hemisphere of the cerebrum. This is horizontally directed sulci. And the cortex surrounding the fissure is known as your perisylvian cortex. Then you have the parieto-occipital sulcus. This is a deep fissure on the medial surface of the cerebrum, and it will mark the separation of the parietal lobe from the, specifically the preconus of the parietal lobe from the conus of the occipital lobe. So it is only the parieto-occipital sulcus which will clearly delineate and separate the parietal from the occipital sulcus, and this is seen on the medial surface, because on the lateral surface, it will take some imagination to separate the parietal from the occipital sulcus. Then you have the collateral sulcus, or with an acronym of COS. This groove separates the lingual gyrus and the parahippocampal gyrus from the fusiform gyrus. So this is seen in the medial surface of the cerebrum, and it is about in the temporal lobe on the medial surface. Then you have the lingual gyrus, which is separated from your fusiform, which is known as the medial occipito-temporal gyrus. And this is involved with the processing of vision, especially related with letters, and also play a role in the analysis of logical condition. Then you have the fusiform gyrus, which is also known as the lateral occipito-temporal gyrus, which is found in the inferior temporal cortex. This plays a role, an important role in the object and face recognition, and also recognition of facial expression. So you can, if sometimes somebody will approach you and is, hey, do you recognize me? And you happen to forget that face. You happen to be disconnected with the face and the name. You can say, oh, I'm sorry, but my fusiform gyrus is not working. And it will make you a medical student, because this will make your friends What are you talking about? Say, what are you talking about? Okay, we have the second, the next typical fissure, the central sulcus of Rolando. This is very understandable. You should know and recognize this sulcus because this is a favorite structure that Dr. Gasco will put a pin on. Take note. So this is a fold in a cerebral cortex, and it has other names. It can be accepted. I can accept that in the practical exam. If you call it as a central fissure, or the fissure of Rolando, or the Rolandic fissure. Now, this will separate the frontal and parietal lobe, and thus it will separate the primary motor cortex, which is your frontal lobe, and separate also it from your primary somatosensory cortex. We will talk on that later when we go to the gyri. Then you have the Calcarine sulcus. This is an anatomical landmark found at the caudal end of the medial surface of the brain, dividing the visual cortex into two. So it follows an undulating course from the parieto-occipital sulcus anteriorly to the occipital pole posteriorly. So your calcarine sulcus will intersect your parieto-occipital sulcus, separating your um, your temporal and your what's this? And temporal and your occipital sulcus. Then you have your interhemispheric fissure. This is a deep sulcus to the corpus callosum, dividing the brain into two hemispheres. So you have it here. And what you will find at the depth of this in a fissure will be your falx cerebri. Now the Sylvian fissure, so this is a lateral fissure, and it is deep and mostly horizontal. And when you open it, when you open this remember, this is another favorite structure that will be found in your practical exam. Insula is buried within it, and it will separate your temporal lobe from your parietal and your frontal lobe. So remember, this is a Sylvian fissure. So take note as to the position of the 6 constant fissures in the cerebral hemisphere, which is lateral, which is medial, and there are some which will traverse from your lateral surface to go into the median surface, and we will take that up as we go along. Then you have the collateral sulcus. This will separate your lingual and perohippocampal gyri from the fusiform gyrus. So that is, if you will notice, this is a medial fissure because you have here your corpus callosum. And you can find this on the inferior surface. You'll have here the occipital pole. Then you have this is your parieto-occipital. So this makes it the parietal pole. Then you have here the central sulcus of Rolando traversing, going into the going into the medial surface. So you can see that this is anterior to that will be your frontal lobe, and posterior will be your parietal lobe. So the lateral surface of the brain, this is the lateral surface of the brain. So that the typical fissures, you have here your lateral sulcus of Sylvius. Then you have the central sulcus of Rolando. Then what's this? This will now be the inferior surface of the temporal gyrus or temporal lobe. So you have your temporal lobe here, you have your frontal lobe here, and you have your parietal lobe here, and your here you have your occipital lobe. So the medial surface of the brain, you have the important marker that you should remember is the cingulate gyrus. And then the corpus callosum, this one. Your corpus callosum is below your cingulate gyrus. So here you have the frontal lobe, the medial frontal gyrus, your paracentral lobule, your preconus, which belongs, your paracentral lobule belongs to your frontal and your parietal lobe. Your preconus, it belongs to your parietal lobe. Then what will separate here will be your parieto-occipital sulcus, which will separate your preconus from your conus. Then you will have here your calcarine sulcus, calcarine sulcus, which will extend or unite with your, this is your it will intersect with your parieto-occipital sulcus. Then the basal surface of the brain, what you will see will be the inferior, what you will see will be the temporal and occipital lobe of the, or gyrus of the cerebral hemisphere. Now, your parieto-occipital fissure is a very deep, open, Y shape from the sagittal view and X shape in a horizontal or coronal view. And you have your this is the red one is your central sulcus of Rolando, and it usually freestanding. There will be no intersection, and it will separate the frontal and parietal lobe. That's why you can to identify, because you might get confused. There are so many sulci there. You might be to identify where the central sulcus of Rolando is. You identify a sulci which is freestanding and has no intersection, and this will so you have to identify which is the frontal lobe and which is the parietal lobe to identify frontal or the anterior portion or the posterior portion, so that you can identify which is the frontal lobe and which is the parietal lobe. Then you have your calcarine sulcus. This is a medial structure. You can see here, you can identify here, that is the That is the corpus callosum. So if you are to locate the lobes of your brain, you can use your palms. Your frontal lobe, you can put put your palm in your forehead. That will be where your frontal lobe is. And when you put your palm a little bit above your nape, that will be the occipital lobe. And if you will put your parietal lobe at the top of your head, if you put your palm at the top of your head, you will be that will overlie the parietal lobe. And if you put your arm or your palm at the area where your ear is, it will overlie your temporal lobe. I will not include to discuss the limbic lobe because Dr. Ongbit has already discussed this with you. And the insular lobe, for some neuroanatomists, um, they consider the insular lobe as one of the lobes of the cerebral hemisphere. But as far as Snell is concerned, the insular lobe is a lobe which has a specific function, but is not included in the lobe that will make up the cerebral hemisphere. So your frontal lobe is the anterior region of the hemisphere. It is anterior to the central sulcus of Rolando and superior to the Sylvian fissure. Can you imagine that? Then the parietal lobe will be the posterior region of the hemisphere, posterior to the central sulcus, but anterior to the parieto-occipital sulcus. So on the lateral portion, on the lateral surface, you cannot see much or appreciate much the parietal occipital sulcus. It is more appreciated on the medial surface. Then the occipital lobe is posterior to the parieto-occipital sulcus. Then you have to remember that it is difficult to differentiate or delineate the parietal lobe and the occipital lobe in the lateral surface. Then you have the temporal lobe, which is inferior to the Sylvian fissure and anterior to the angular gyrus. So the lobes of the brain, you have the frontal lobe. The lobes are made up of different gyri or gyrus. You have the precentral gyrus, which is located anterior to the rhandic fissure, but it is posterior to the precentral sulcus. So this is your primary motor cortex. Now, you have, if the precentral gyrus will be running parallel to the Rolandic fissure. But what will be perpendicular to the Rolandic to the precentral gyrus will be the superior frontal gyrus, because there will be two sulci that will intersect the precentral sulcus. This is the superior frontal gyrus is the gyri between the superior frontal sulcus and the superior margin of the brain. Then you have the middle frontal gyrus. So this will be located between the superior and inferior frontal gyrus. And this will be separated from the superior frontal gyrus by the superior frontal sulcus. Then the inferior frontal sulcus separates the middle frontal gyrus from the inferior frontal gyrus. So part of the superolateral surface of the frontal lobe is the middle frontal gyrus. And anteriorly, it will abut the frontopolar cortex. Posteriorly, it will be separated from the precentral gyrus by the precentral sulcus. So you have to imagine you have the precentral gyrus, and you have the precentral gyrus, then you have the postcentral gyrus, and between that you will have the volandic fissure. Then anterior to that will be the precentral sulcus. Now this precentral sulcus is vertically oriented. Then you will have two sulci that will intersect the precentral uh, sulcus. It will be your superior and your inferior sulcus. And from that, there will be three gyri. The superior frontal gyri, the middle frontal gyri, and the inferior frontal gyri. Now, your inferior frontal gyri is found below the inferior frontal sulcus, divided into three areas by two rami coming from the lateral sulcus of Sylvius, which will form your pars opercularis, your pars triangularis, and pars orbitalis. I'm sorry. So the rami that will divide your inferior frontal gyrus will be your ascending ramus of the lateral fissure and the horizontal ramus of the lateral fissure, making three lobules, your pars opercularis, pars triangularis, and pars orbitalis. Now, your pars opercularis is an opercular part or superior part of the inferior frontal lobe. This is the cortex posterior to the ascending ramus of Sylvius. Then you have the pars triangularis, which is a triangular-shaped cortical region of the inferior frontal lobe, inferior frontal gyrus in the frontal lobe. This is located between the pars orbitalis and the pars opercularis. So meaning to say that the pars triangularis is between the two lobules that will be formed in the inferior lobe. Then your pars orbitalis is the most rostral portion of the inferior frontal gyrus of the frontal lobe, located anterior to the central ramus of the lateral fissure of Sylvius. Now, the function will be the convergence of semantics and emotional expression. Then we go now to this is in the pars orbitalis, the pars opercularis, and the pars triangularis is found on the basal surface of the cerebrum of the inferior frontal lobe, going almost reaching the medial part. Now, in the medial part, you have the paracentral lobule, which is on the medial surface of the cerebrum, which includes both the frontal and parietal lobe. So your paracentral lobules, there are two lobules that are located there. um, intersected by or separated by the central sulcus of Rolando that has gone medial. So this is the paracentral lobule is the medial continuation of the precentral and postcentral gyrus. Remember, your precentral gyrus is belongs to your frontal lobe, while your postcentral gyri will belong to your parietal lobe. And in between them, you will have the oh no, you will yes, you will have the Rolandic fissure. Now, the basal surface of the frontal lobe, you have the rectus gyrus and the straight gyrus, or the straight gyrus. When you say rectus, that's Latin name, Latin term for straight. This is an anatomic structure located at the medial-most margin of the inferior surface of the frontal lobe. And this may be involved in higher cognitive function like personality. So when you have probably if you have a very good personality, you have a well-developed rectus gyrus. Just joking. Then you have the orbital gyrus, which is the inferior orbital surface of the frontal lobe, and this is concave shape, resting on the orbital plate of the frontal lobe. Now, this will be divided into 4 orbital gyri, a medial, anterior, lateral, and a posterior gyri. Now, this gyri has a shape, has an H-shaped configuration. So the medial sulci will separate the anterior and posterior gyri. So it will be here, this is H-shape. You have the medial sulci here, and you have the anterior and the anterior and a posterior orbital gyri. Then lateral to these two separated by a lateral long arm of the H shape is the lateral orbital gyrus, and medial to the long arm of the H is the medial orbital, which is between the olfactory sulcus and the medial orbital sulcus. So you have here the anterior orbital gyrus, the posterior orbital gyrus, then um, the medial orbital gyrus, and the lateral orbital gyrus. Then the gyrus rectus is lateral to the medial orbital gyrus. So it will be seen it will be seen here because you have here the medial orbital gyri. So what will be medial to that will be the gyrus rectus. So this is your lateral surface of the brain, as I have already let you see. So there is no actual fissure that will be seen here in the straight line, but on the medial side it will be congruent to your parieto-occipital lobe fissure. So you have here the inferior, the temporal lobe. It has 3 gyri, and of course it has 2 sulci. Then you have your frontal lobe here. It will include your precentral gyrus and the 3 frontal gyri, your frontal, your middle, and your inferior frontal. So you have here and this area will be your inferior, oh, yeah, inferior frontal sulcus and your superior frontal sulcus. Then on the parietal portion, you will have the post-central gyrus, the superior parietal lobule, and the inferior parietal lobule. You can see here that uh, you can see here that the parietal lobe will be separated from your occipital lobe by just and you cannot see that you cannot actually trace the the parieto-occipital lobe separating the two lobes. But here it is more clear the separation of your parietal and your occipital lobe. So the frontal lobe constitutes the entire region in front of the central sulcus. Immediately in front of the central sulcus lies the precentral gyrus, which is the primary motor region of the cerebral cortex. And in front of the precentral gyrus, the rest of the frontal lobe is divided into your superior, middle, and inferior frontal gyri. So remember, your frontal lobe has 3 gyrus because it has 2 sulci. So in summary, the frontal lobe has 3 sulci, the superior, inferior, and precentral sulcus. But it has now this precentral sulcus will be parallel to your Rolandic fissure or the central sulcus of Rolando. That is your reference sulci, your precentral sulcus, or your central sulcus of Rolando. And it will have 3 gyri, your superior, middle, and inferior frontal gyri, and the precentral gyrus. Now, these 3 will be parallel or will be entered perpendicular to in orientation compared to your precentral, which will be this one will be horizontal, sorry. So horizontal in orientation, while this will be vertical in orientation. So this is the different gyri and the different gyri that will make up the frontal lobe. On the lateral surface, you have the precentral, the superior frontal, and the middle frontal and inferior frontal gyrus, and your inferior frontal gyrus will be subdivided into 3 by your um, rami coming from your lateral sulcus of Sylvius. Then on the medial surface, you will have the medial frontal gyrus, which is actually an extension of your frontal gyri, a medial extension of your frontal gyri, and your paracentral lobule, which is made up partly anteriorly by your frontal extension of your precentral gyrus, and posteriorly the postcentral gyrus. Then on the basal surface, you have the rectus gyrus and the orbital gyrus divided into 4 lobules. So you can see here the uh, central sulcus of Rolando. This is a very important uh, anatomic structure or marker which will divide you into your superior, in your frontal lobe and your parietal lobe. And then this is your Sylvian fissure, which will um, separate your temporal lobe from your parietal and frontal lobe. Then on the medial surface, you have to remember this as your reference point, your corpus callosum. This is a white matter and you can delineate it from the cerebral hemisphere, which is gray matter. Then you have here the marginal sulcus, which will separate your paracentral lobule from your preconus. This is the basal surface of the frontal lobe, wherein you have the gyrus rectus, and then you have the, which will be medial to your olfactory tract, and then so this is part of the frontal lobe still, but on the inferior or on the basal surface. So we go now to the lobe of the cerebral hemisphere, which is posterior to the frontal lobe and posterior to the central sulcus of Rolando. This is positioned above the temporal lobe and separated by the lateral sulcus of Sylvius. So your parietal lobe will be above or superior to your temporal lobe, and in between them, you will have the lateral sulcus of Sylvius. This is found posterior to the frontal lobe, separated by the central sulcus of Rolando. So there again, you have anterior to the central sulcus of Rolando will be your frontal lobe, and posterior to that will be your parietal lobe. Now, the function of your parietal lobe is to integrate sensory information among various modalities, including spatial sense and navigation, or what you call as proprioception. The main sensory receptive area for the sense of touch in the somatosensory cortex, which is just posterior to the central sulcus in the postcentral gyrus and dorsal stream of visual system. Anterior to the parietal lobe is the frontal lobe, and between them is the central sulcus of Rolando. Inferior to the parietal lobe is the temporal lobe, separated by the lateral sulcus of Sylvius. Posterior inferior is the occipital lobe, which is not clearly separated from the parietal lobe in the lateral surface, but in the medial surface delineated by the parieto-occipital sulcus. The lateral surface of the cerebrum. You have the parietal gyri. I use the term gyri because there are many gyrus there. You have the postcentral gyrus, which is a prominent gyrus in the lateral parietal lobe located between the central sulcus of Rolando and the postcentral sulcus. Now, this gyrus is parallel to your precentral gyrus, and this is the primary somatosensory cortex. So, if your postcentral gyrus is the primary somatosensory cortex, the precentral gyrus is the primary motor cortex. Then you have the superior parietal gyrus. This is involved with spatial orientation and receives visual input as well as sensory input from one's hand. Involved as well with general function of parietal lobe. Above the interparietal sulcus and posterior to the postcentral sulcus, you can find the superior parietal gyrus. And this can be said to be perpendicular to the postcentral gyrus. The inferior parietal lobule is located in the inferior portion of the parietal lobe posterior to the postcentral lobule and above the temporal lobe. This plays a role in visuospatial processing. And this will be concerned with language, mathematical operation, and body image, particularly the supramarginal and the angular gyrus. Then you have the supramarginal gyrus, which is located at the inferior portion of the parietal lobe, traversed by the ascending ramus of the lateral sulcus of Sylvius, probably involved with language perception and processing. Then you have the angular gyrus, which is part of the inferior lobe of the parietal lobe near the superior edge of the temporal lobe and immediately posterior to the supramarginal gyrus. So your angular gyrus is anterior to your supramarginal gyrus. Then this is involved with number of processes related to language, number processing, and spatial cognition, memory retrieval, and attention. Now, on the medial surface, you will have the paracentral lobule, medial surface of the parietal. This is the continuation of the precentral and postcentral gyri. Controls motor and sensory innervation of contralateral lower extremities and responsible for control of defecation and urination. Then you have the preconus, which is a portion of the superior parietal lobule on the medial surface of each brain hemisphere. So you have two preconus. Now, this is located anterior to the conus, separated by your parieto-occipital lobe. So this is what I have been telling you, that you have what will separate your medially, what will separate your, what it can be seen clearly, the separation of your parietal and your occipital lobe. Wherein in the parietal lobe, you will have the preconus lobule. And in the occipital lobe, you will have the conus lobule. And so it will transect or separate these two lobules. And this is involved, your preconus is involved with recollection and memory integration of information. So use your, and there will be an examination. You use your preconus well in recollecting what you have studied and learned and integrate this information to a question. Then you have the sulci. On the lateral surface of the parietal lobe, you have the postcentral sulcus, which is parallel with your central sulcus of Rolando and your precentral sulcus. So this is behind the central sulcus of Rolando and separates the postcentral gyrus from the remainder of the parietal lobe. Now, this sulci will be running vertically parallel with the precentral sulcus and the central sulcus of Rolando. You have an intraparietal sulcus, which is on the lateral surface of the parietal lobe and consists of an oblique and horizontal portion. This is highly involved in sensory motor function, and different subregions or other areas of this sulci is involved in the planning of the eye and grasp movement, reaching and defensive forelimbs, and head movement. Now, on the medial surface, you will have the parieto-occipital sulcus, clearly delineating the parietal lobe from the occipital lobe. And more specifically, separating the preconus, which is found on the parietal lobe, from the conus, which gyri, which is located on the occipital lobe. Then you have the marginal sulcus, known also as the pars marginalis. This is an extension of the cingulate sulcus posterior-superiorly and separate the paracentral lobule from the preconus and considered as termination of the cingulate sulcus. So in summary, your parietal lobe has two sulci, your postcentral sulcus and your intraparietal sulcus. And it has three gyri, the postcentral gyrus, which is separated from the postcentral, separating the postcentral sulcus and the the rest of the parietal lobe. And this is, and you have also your intraparietal sulcus separating the superior and inferior parietal gyrus. So on the lateral surface, you have three lobules. You have the three gyri. You have the postcentral gyrus, which is the primary somatosensory area, the superior parietal lobule, and the inferior parietal lobule. This is also known as your Wernicke's area. And your inferior parietal lobule is divided into your supramarginal and your angular gyrus. Then on the medial surface, you have the paracentral lobule, which is made up of the continuation of your precentral and your postcentral gyri and your preconus. So you have here the parietal lobe. So this is your central sulcus of Rolando. So posterior to that would be the start of your parietal lobe. And this will be your postcentral gyrus, which is the primary sensory area. And you will have the interparietal sulcus dividing your superior parietal lobule and your inferior parietal lobule. Then you will have here the central sulcus of the lateral sulcus of Sylvius, which will have a ramide that will pass through your inferior parietal lobule. So you have here your parietal lobe. So starting the anterior portion will be made by your post-central sulcus. You have here your post-central gyrus. So when during the practical exam, you have to know where the central sulcus of Rolando on the lateral surface so that you can delineate where is your parietal lobe and where is your temporal lobe. And you have also to know the lateral sulcus of Sylvius so that you can delineate where is the temporal lobe, where is the parietal lobe, and where is the frontal lobe. Here in the, you can safely say that this is the occipital lobe. But if it is still within if that area is still within the Sylvian, within your Sylvian fissure, you can be sure that uh, it is your uh, it is your temporal lobe still. So in the medial surface, be sure to know where your parieto-occipital fissure so that you can delineate where the parietal lobe and where the occipital lobe is. When we go now to your temporal lobe, this is located beneath the lateral fissure of Sylvius and both cerebrum. This is in close proximity to the ear. So remember earlier where I made you put your palm in your head. The area, if you put your palm in the region of your ear, you are in the proximity of your temporal lobe. Now, this is the location for the primary auditory cortex, which plays a role in interpreting the sounds and language. So this is the hearing lobe and communicates with the hippocampus to play a key role in the formation of explicit long-term memory modulated by your amygdala. Now, the gyri of the temporal lobe, you have the superior temporal gyrus. This includes the Wernicke's area, which is the major area involved in the comprehension of language and in most people in the left hemisphere. So dominant for hearing, it is dominant, dominant in the left hemisphere. Now, this will contain the primary auditory cortex, which is responsible for processing sounds. Now, sites of multisensory integration will be played by your superior temporal gyrus, and this plays a role also in spoken word recognition. Wernicke's area has a role which extends beyond that of higher level of perceptual processing, and this was found to be comprehension of language. So this lies between the posterior ramus of the lateral fissure and the superior temporal sulcus. You can identify the Wernicke's area by noting the 6 convolutions, uh, the 6 convolution, you will note, this will be referred to as the 6 convolution of the temporal lobe, the Wernicke's area. Then you have the middle temporal gyrus. This is located between the superior and inferior temporal gyrus, located on the lateral surface of the cerebrum. It is involved in vision, memory, sensory input, language, emotion, and comprehension. And this will form part of the limbic cortex, which include the amygdala, oncus, hippocampus with subiculum, entorhinal and perirhinal cortex, and the fusiform vein. So your middle temporal gyrus will be sort of uh, I know, will be sort of joining um, with your limbic cortex. Now, the inferior temporal gyrus, this is the cortex covering the inferior side of the temporal lobe. Now, this is found below the middle temporal gyrus. And this will extend around the inferior lateral border onto the inferior surface of the temporal lobe, where it will be limited by your inferior temporal sulcus. Now, the cortex is important to visual processing and visual object recognition. Now, the medial temporal lobe, together with your median diencephalic structure, are thought to play a crucial role in declarative memories and serve as a temporary deposit of your uh, uh, temporary deposit of the information in the final storage being at the neocortex level. So this is on the medial surface of the temporal lobe, your medial temporal lobe. Then you have the occipito-temporal gyrus. This is fusiform and otherwise known as the lateral occipito-temporal gyrus, located between the lingual and parahippocampal gyrus above and inferior to the inferior temporal gyrus below. Now, this will play a role in the object and face recognition and facial expression. Then you have also your parahippocampal gyrus. We are already on the medial side of your temporal lobe. You have the temporal part of the medial occipito-temporal gyrus, your parahippocampal gyrus. The occipital part is referred as the lingual gyrus, and this is found in the medial aspect of the temporal lobe and occipital lobe. And your parahippocampal gyrus will play a part in the limbic system and plays a role in the memory encoding and retrieval. So when you study, you you store what you have studied in the parahippocampal gyrus and you have to retrieve it there. Then you have the temporal sulci. There you have your superior temporal sulcus, which is parallel to your lateral sulcus of Sylvius. So this will separate the superior temporal gyrus from the middle temporal gyrus. And this will be the first sulcus inferior to the lateral fissure of Sylvius, and believed to be the main region for audio-visual integration, and also believed to be one of the core structure for theory of mind. Now, the inferior temporal sulcus separates the middle temporal gyrus from the inferior temporal gyrus. And this runs longitudinally along the inferior lateral surface of the temporal lobe, parallel to the superior temporal sulcus. Now, your inferior temporal sulcus will traverse the concave inferior surface of the temporal lobe which is continuous posteriorly with the tentorial surface of the occipital bone. So in summary, you will have the two sulci, the superior temporal sulcus or the parallel sulcus and the inferior sulcus, dividing the surface of the temporal lobe into three gyri, the superior temporal gyrus, the middle temporal gyrus, and the inferior temporal gyrus. So on the lateral surface, you will have the superior, middle, and inferior temporal gyrus. While on the basal surface, you will have the occipitotemporal gyrus, which is made up of your medial occipitotemporal gyrus and your lateral occipitotemporal gyrus. Know what are their other names. So you have here the temporal lobe. So the marker will be your Sylvian fissure. This one. Separating your temporal lobe from your frontal and your parietal lobe. So you have the superior temporal gyrus, the middle temporal gyrus, and the inferior inferior temporal gyrus. I don't like this. So this is the basal portion, and you can see here on this area will be the basal portion of your temporal lobe. So we go now to the most posterior portion of your cerebral hemisphere, which is your occipital lobe. The boundary is between the parietal lobe and the occipital lobe is not coincident with a single sulcus on the lateral surface of the hemisphere. You have to remember that because if you have to make your own marker to delineate which is on the lateral surface, which is the occipital lobe and which is the parietal lobe, because there is no single sulcus that will delineate or separate these two lobes. However, it is clearly marked by a deep parieto-occipital sulcus on the medial surface. The occipital lobe does not bear any important landmark on its lateral surface, but on the medial surface, the prominent calcarine sulcus will indicate the location of the primary visual cortex. So this will delineate your calcarine sulcus will delineate which size it will clearly indicate where the occipital sulcus is, including the parieto-occipital sulcus as seen in the medial surface. So the lateral occipital gyri, you have a superior occipital gyrus, which is the superior part of the occipital lobe. Anteriorly, it is bounded by your parieto-occipital fissure. Then laterally by your intraparietal sulcus, and medially by the lateral boundary of the conus. The middle occipital gyrus is the largest gyrus in the occipital lobe. And the anterior boundary of your occipital lobe is your middle occipital gyrus. It has an anterior and a posterior segment, and this is located between the superior and inferior occipital gyrus. The major convolution on the lateral surface of the occipital lobe will be seen in the middle occipital gyrus. This is shown to have preference for spatial over non-spatial processing of both auditory and tactile senses. The inferior occipital gyrus is connected to the amygdala via your white matter connectivity, allowing the inferior occipital gyrus to form a network for facial recognition with the amygdala. Now, on the medial surface of the occipital lobe, you will see the conus, which is wedge-shaped area between the calcarine fissure and the medial part of the parieto-occipital fissure. This will receive visual information from the contralateral superior retina, representing the inferior visual field. Then you have the lingual gyrus, known also as the medial occipito-temporal gyrus. Now, the brain structure linked to processing vision is especially related to letters. So, plays a role in analysis of logical condition and encoding visual memories. Now, this is a tongue-shaped structure that lies on the medial aspect of the occipital lobe along the inferomedial or tentorial surface. So, your occipital lobe, on the lateral surface, you have the lateral occipital gyrus. You have your superior occipital gyrus and your inferior occipital gyrus. And on the medial surface, you have the cuneus and the lingual gyrus. While on the basal surface, you have the lateral occipitotemporal gyrus or your fusiform gyrus and your medial occipitotemporal gyrus or your lingual gyrus. The occipital lobe has uh, two sulci, the superior and inferior occipital sulcus. You have to take note that the superior occipital sulcus is an extension of your intraparietal sulcus, which can be seen more on the intraparietal in the medial surface. Then the inferior occipital sulcus is an extension of the inferior temporal sulcus. You have to, because it has true sulci, it has three gyri. The superior, middle, and inferior occipital gyrus. So you have here, this is just an on the medial side, this will be the line that will be, this line will represent the parieto-occipital. So you have here the occipital lobe, then you have here the parietal lobe, and since you have your sagittal lateral sulcus of Sylvius, this will be your temporal lobe. So you have your lateral occipital gyri, your transverse occipital sulcus, and here you will have your lateral occipital sulcus. So basically this one, since this is your parieto-occipital fissure, and this will be your Calcarine ito eh. You will have here the occipital lobe. We'll not discuss with this with your limbic lobe. So let me rest for a while. We will go now to the So let me just talk a little about this. You have to remember that some neuroanatomies consider the insular lobe as one of the lobes of the main lobe of the cerebral hemisphere. But as far as Snell is concerned, this is not. This is just part of the cerebral hemisphere. And this lies deep in the floor of the Sylvian fissure, overlapped by the frontal, temporal, and parietal lobe. Remember, in the practical exam, if Dr. Gasco will open up the lateral fissure of Sylvius, and put clamp in between the fissure, and he will ask what is at the tip of this clamp. That is the insular lobe. Now, the insular lobe is thought to be involved in sensory and motor visceral function, as well as taste perception. The insular lobe, although it is small, it is uh, well delineated sulci and gyri. So it has three sulci: the central sulcus of Rolando, which will be traversing through the insular lobe, the short insular sulcus, and the precentral sulcus, which will also traverse inward to the sulci. Then the gyri will be an anterior insular lobule and a posterior insular lobule. Now, your anterior insular lobule is also known as your short insular gyri. It is an anterior short insular gyrus made up of your anterior insular lobule is made up of your anterior short insular gyrus, middle short insular gyrus, and a posterior short insular gyrus. While the posterior insular lobule, which is also known as the long insular gyri, and is made up of your anterior long insular gyrus and the posterior insular gyrus. So this is what I mean when this is the Sylvian fissure. It is being opened up to expose the insula. But in my practice with the anatomy, it has never been done that the insula was dissected and put out. Abot lang ito yan pag open up hiton Sylvian fissure. These are already I will leave that for your study with Dr. Ridonia, because these are MRIs already. We will continue with the internal structure of the cerebrum. Wait lang. Just want to have a break. Jack! Stop ano eh. Makatupan mo sa. Stop ano eh.